Welcome back to our channel, Senior Pal Community. In this episode, we're going to be speaking about the basics of Medicare, which we call Medicare 101. And in essence, we're going to go over the fundamentals for this government program for the current year of 2025. And as you know, our philosophy is knowledge plus understanding will give us the senior power. And as a matter of fact, to talk about power, the episode and a lot of what we have done has been greatly assisted through the use and intervention of artificial intelligence. And we're going to be getting on in some other episodes working at this at rather deeply so that we can acquaint you with the fact that AI is not something you should be afraid of, but something that can improve the overall quality of your life quite significantly. And what we're also going to be addressing is the fact that there are many of these myths that are going around about Medicare, what can be done, what can't be done. Legally, not that much. It has to basically stay the way it is, except for some positive changes. And we'll see what happens, of course. So we're going to be differentiating the reality of this benefit that Americans have, seniors in particular, to see what we really are entitled to and why we should be quite happy having this. Right, let us now go through the agenda for this episode, which is a guide for seniors on Medicare basics and changes for 2025. And we're just going to introduce again the Senior Power community so that you get an idea of, in general, what we're trying to accomplish, and then go through an introduction to this Medicare 101 and go through each of its parts, look at its impacts, and even the challenges that are presented by this legislation. And then the next episode you will see, as we will bring to your attention, will be drill downs on several of the podcasts which we have already given, which have provided introductions. And of course, please like and subscribe. It means tremendous things to us. Thank you. I'm sure you will.
All right, everyone. Let me bore you a little bit by introducing myself. As mentioned before, my name is Joel, and believe it or not, we just celebrated our 57th wedding anniversary, my wife and I. And we had a really nice time with my son and the grandchildren. I do like to travel. I like to read. Some people say I'm pretty good at cooking, and I do like to work. And I believe that you get into big trouble once you stop working. Maybe that's something we should all consider. As you will see, I am an academic by nature, and I am definitely a member of the Senior Power community. Uh, I was born and I was brought up in New York City, in Brooklyn, as you can tell from my accent. But I have lived in Colorado, and right now we're in Arizona. My education, for better or for worse, is rather extensive. I went to Stuyvesant High School, which was and is a highly specialized high school for nerds in New York City. And then I got my bachelor's degree from what is known as the poor man's Harvard, City College of the City University of New York. And I did my PhD at the State University of New York at Albany. So I am a product of the state. I've been a professional consultant for more than half a century. Yeah, oh my God. With clients in government, non-governmental organizations, and in commerce. And I specialize in areas of security, basically for the government, and on the commercial side as well as on the government side in healthcare. and related specialties.
Hello, everyone. Hello, everyone. As we said, I'm Mark. I'm going to introduce myself as well. I'm on the verge of the senior community, not all the way there yet, but just approaching retirement. But what makes me, the biggest thing that makes me part of the senior community is that I am what commonly characterized as the sandwich generation. So I support my 94-year-old mother, God bless her, who is in great health, but continues to need active support, both in financial and daily and health issues. So this is near and dear to my heart, everything that we're doing here. Not directly related to Joel, but Joel and I have a very, very close relationship and are now part of the same community. I specialized a lot in technology throughout my career, and the current focus that I've had is on artificial intelligence. And one of the things that drew me to participating with Joel in this community is very, very few people are taking the artificial intelligence that's available today, that is creating a lot of activity and a lot of development, a lot of change, and applying it to the senior community. And I don't want the senior community to miss out, because this is, in some respects, scary, but in some respects, it is so transformational and powerful. I want to make sure that you guys have the opportunity to leverage it and understand it and not be afraid of it, but instead improve your quality of life by using artificial intelligence. I've been in the industry 30 plus years, still on the rear side of the career, but still active. Computer engineering degree in electrical engineering, and a focus on privacy and cybersecurity that got me involved in both the security side as well as the artificial intelligence side of what we're talking about, because it's important to also realize there's a lot of threats out there and things that we need to be careful of. All right. And next, we'd like to introduce Amy. Amy's our AI companion, as we said, AI for the senior community to work to us. And we want to both leverage the AI in our conversation, but we also want you to experience what it's capable of. So, Amy, can you introduce yourself?
Hello, everyone. I'm Amy, an AI companion here to support our senior community. I specialize in improving the quality of life for seniors, drawing from my background in sociology. I'll be here to provide insights and answer any questions you might have. Looking forward to our conversation.
Perfect. Thank you, Amy.
You're welcome. Happy to be part.
Why this community? The purpose of this community and its channel is to provide the listeners, the subscribers, the general public with actionable information. Information that is validatable, that is real to the best of our knowledge. And use that information to make what we call informed decisions. Informed decisions are decisions which are based on information which can be trusted, and that is useful and relevant. And this will be on such topics as health, independence, safety, security, and so forth, which is quite a bit of information we will be sharing with you. Summing up, it will therefore help us all improve the overall quality of our life. We provide community support because we understand, being seniors ourselves, or close to it, what are our generation's highly complex needs. And not to waste any time, we are only going to address critical and timely topics so that we can emphasize what truly has the greatest impact on our community. And we are independent. We minimize the use of outside influences to zero, we hope. However, we do listen to our community, and you can write your comments and so forth, send them by email, or you can respond directly below in the comments. We read them, and we want this to be the way it works. We have quite a bit of knowledge in this area, and what we believe is the truth, which of course has to be modified certain times, but we are really limiting any of these outside influences. And then we are presenting, again, what we believe, everything that this community needs, but it's all in one place. There are other podcasters on the web who also address these topics in one depth or another. However, they do not have it all in one place. You have to go all over different podcasters and so forth. And by the time we're finished, I know it's happened to me, we're more confused than when we started. The bottom line, conclusions are based on transparent and validated information sources. Thank you, Mark. You did a great job here. And let us begin in the beginning, basically, with the very fundamentals. I want to make sure you understand that people are eligible for Medicare when they reach 65, and then there are certain younger people who may have some disabilities, and then there's a special category with people with end-stage renal disease. You will see when we go through this that there are 4 parts providing different kinds of health care into Medicare. And I just want to call your attention to one thing. In the center is a picture of a Medicare card. Please take notice. People have forged these cards. Be very careful who you give it to and how you give it. A lot of times physicians practice will ask for these cards to make a copy of it, and I want you to consider whether or not this should be done. This is quite critical. What we have to do is, as we're beginning this, we have to learn some key definitions without which we're going to be a bit lost as we go on to try to learn about the basics of Medicare. The first is a premium. This is an amount charged, in this case by the government, of $185 per month every single month as long as you have this insurance or you're paying for Part B. Now, there is some adjustment for those who are making a really greater income than the average people. So they pay a little bit more of the fair share. Okay, so that everybody pays. Now, depending upon your plan, you could also have what is called the deductible. And that means before the insurance starts to pay, you got to still pay additional monies. And again, depending upon your plan, that could mean before you get recompensed by your insurance company, you might have to spend $5,000, $6,000, $7,000, depending upon your plan, of your own money, what is called out of pocket. Right? Then we have the co-insurance, another class. Okay. The insurance company will pay a certain amount, for example, every time you see a specialist. And that could be $100, $200 or whatever, or more, directly to the specialist. And you are going to pay a percentage of the costs after you met that deductible. So sometimes this co-insurance is fixed. A lot of times that is in the case of Medicare Advantage. And other times you have to pay a percentage. So I know that a lot of people on Medicare Advantage may pay $10, $20 a visit every time they see a specialist, such as a heart person. And this adds up too. Okay? So you can have that, or you can have a percentage of the cost of the visit. The cost of the visit could be $200. I'm just making it up. And maybe you have to pay 10%, so you would pay $20 every time you go and have one of these specialist visits. And then we have the formulary, which is the list of drugs that are covered by Medicare Part D or the Medicare Advantage plan, where usually Part D is included. And the drugs go through a schedule. Every drug has a cost to you and a lot of other rules. And then finally, you have an out-of-pocket maximum. And this has been set, again, by the government every year. But for original Medicare, but for Medicare Advantage, these out-of-pocket maximums will also vary by your plan. And that will be, let's say you have an out-of-pocket maximum of $3,000. Once you meet all this expense of co-insurances, drug costs, and any other type of out-of-pocket costs, for example, hospital cost, you have to go beyond the $3,000, and then the plan will pay 100% of the additional costs. But it's a big trip to get to that point, and you don't really want to get to that point, because that means that you have some type of chronic illness or something along those lines. Now the fun begins. We're going to talk about the first part. And Medicare likes to say it covers. It sounds like it's covering everything. Okay, so let's keep that in mind. And this part is often referred to as hospital insurance. So it's when you go into the hospital or a skilled nursing facility, God forbid a hospice, and certain home health care is covered by this Part A. And it will include room charges, meals, nursing care for those admitted as patients. This can get expensive as well, because you do have to pay a per diem to the hospital, but there is even ways of somewhat getting around this. And most of the time, you never ever have to pay a monthly premium. Okay, if you paid your Medicare income taxes, I guess you would call them, while you were working. So that's a good thing most of the time. But again, remember, there are costs associated with each of the benefits, and these include deductibles and co-insurance, which could get rather pricey. No, what I'm saying here is you got to know your Medicare Part A coverage and its limitations, and it is essential to have a good understanding of this for everybody in our community. People play tricks out there. Take my word for it. We're going to get into this when we talk about some scams. Continuing our journey, let us take a look at Medicare Part B. I know that this is somewhat tedious. People believe, and many of them are correct, that they know what this is about, but take my word for it, it's not that clear. And we will go through each of these parts in subsequent presentations. Medicare Part B quote unquote, again, covers outpatient medical care. It includes when you go to a doctor, when you have preventive services, usually some things like vaccines. It includes all your lab tests. I've seen instances where they try to charge you for the lab tests separately. Beware. Use of certain medical equipment, such as CPAP machines, and even some home health care and a lot of mental health services. This does require the monthly premium, and that's where the $100 and something comes in. So, and you pay the annual deductible, as we said, and then there's a share of the cost through co-insurance, and they say it's 20% after meeting the deductible, 20% of the cost of a doctor's visit. Doctor's visit could cost $300, so 20% is $60, and that's not a trifle. However, if you belong to Medicare Advantage or you have what is called supplements, which we will get into as well, that will take care of a significant amount of it. So what is Medicare Part B in summary? It's for accessing regular and preventive medical care, managing chronic conditions, and the timely screening and necessary treatments. So it's a good program if one handles this correctly. I know everybody is trying to do that. Moving on through this tedious discussion, I apologize. We're going to talk about Medicare Advantage, which is Part C. And you can see the original Medicare is sort of in the center of this, and the Medicare Advantage covers a lot more things. And you have decisions to make here in terms of which one you want. But remember that Medicare Advantage provides extra services for which, if you just have original Medicare, you have to pay extra to have the benefit. And it includes dental, vision, hearing, and even fitness programs. And you can get a plan that is even tailored to meet your needs. That's very nice. And finally, Medicare Advantage benefits, particularly drug benefits. You got to be very careful because the rules and the amounts and everything else can even change mid-year, particularly as it relates to drugs, and that could be shocking too. But we'll get into that as well. But again, you got to beware of all the ins and outs. Now let's take a look now at choosing the right Part D plan, which is prescriptions, or at least getting a beginning understanding. And please understand that there are catches, and identifying and understanding them will help you to avoid surprises, of which there are many, and financially, it could very well affect your quality of life. Oh, yeah, this can be daunting, and we're having a separate specialized podcast on discussing it, at least on some level. So remember that. So there are many options and formularies, etc. you have to consider. It is worth your time to find what Part D plan will suit you best. And it can make your decision, truly does make a world of difference in your life. Managing your prescriptions, access to preferred pharmacies, and access to various copay levels, and that's just the beginning. So this is a daunting topic, and one which, no matter how complex it seems, you have to understand this and be able to work with it. Medicare, Medicare Advantage, these are not, absolutely not, simplistic exercises. I'm sorry to say. And continuing on Part D and its daunting issues, let me say that in 2025, some Part D plans still have restrictions, such as requiring prior authorization for certain drugs or only generic medications. You, believe it or not, should speak to your physician about this. Because a lot of times when they request that you have a drug, they do not provide complete information that is needed for the insurance company and what is called a pharmaceutical benefit manager. Wait till you hear about that. That has to approve your drug. So you have to be involved in this process. Okay? And it may not work for everybody. While there is some cost reduction, and they say the donut hole has gone away and there's no coverage gap, and we'll talk about all this again, it's not quite true, as usual. Okay? And as we just noted, wait till we talk about the pharmaceutical benefits manager, because I guarantee you, you're not going to believe it. It's going to blow your mind. So navigating all these types of aspects is critical, and you need validatable information and actionable information in order to come to an informed decision. And in our website, we're going to offer tools to help somewhat in tailoring Part D to make your life easier and more financially responsible. Okay, we're going to show a graphic now on Part D. It looks very simple, you know, but let's take a look. Oh, it looks really great. There are three stages. Okay, a deductible stage, initial coverage stage, and a catastrophic stage as it relates to your drugs. It looks nice. For the deductible, you pay 100%. For the initial coverage, you pay 25%, basically. And then when you get into catastrophic stage, you pay 20%. Okay, but things are changing, have changed. It's not quite like this looks. There are ways even around it, and there are ways to get trapped. And these people are experts on getting you trapped. Remember. Let's wrap it up now. We've taken this incredible journey with each other, And let me tell you, it ain't over yet. So what we'd like to do now is take a look at what the next episodes might contain, and builds upon what we presented today and has much more surprises. To begin with, I guess we can all agree that this has been a pretty complex topic and has great impact on our quality of life, and one must be quite aware of what your benefits are in order for you to take advantage of it and to stay out of traps. Okay, the next episode in this series, which is Health and Independence, will drill down further into Medicare 2025, and it'll assist in providing actionable information on how to make informed decisions regarding whether you should choose the original Medicare, so-called, and the Medicare Advantage plans. Yeah, life is an interesting highway with a lot of twists and turns. And anyway, I look forward to sharing more of these fun and games with you for sure. Again, thank you very much for sharing the time with me. Um, and I want to say thank you, really. I mean, it's from the bottom of our hearts. We worked hard on it, and we know that there is some good stuff here for sure. So if you'd like to send in some questions, we'll try to provide some answers. And you can do that by sending an email or by writing in the comments below. And really, please do that. And also, please try to subscribe and like us and all this thing so that we can build the channel further, improve the way we're presenting things, and assure that we're covering things in the proper depth as well as with the correct information and the correct topics. Well, let us know. Thank you.